did all my surgical training there and in Newcastle. And I was appointed to the first chair of urological surgery in Aberdeen's history at the age of 40. So I'm delighted with the opportunities I've had. But of course, I've never forgotten that I am Gambian, and we have traveled with other colleagues, George Fowlis, another urologist, surgeon based in London, other non-Gambian surgeons such as Sam McClinton based in Aberdeen, theatre nurses, and we have come over the past years to work in the RBTH on a charitable basis, and we do that for 3 to 4 weeks a year. This was all started really by George Fowlis, who encouraged us all to come. And I suppose in a lot of ways, for those that we have treated, they have benefited. But it was never lost on us that actually what we must do is to contribute more meaningfully to training and capacity building in the health system, to help work with government to strengthen the health system, but use a sustainable model that ensures that those who can afford to pay for healthcare in the sub-region can be assured of high-quality international standard healthcare, and one uses revenue generated from that through a charitable trust to provide healthcare for those who cannot afford to pay for healthcare, such as women and children under 2 years old. And so we have a charitable trust that has been set up to hopefully allow such patients in the outreach regions that cannot access or have particular types of healthcare to be provided such healthcare at no cost. So that's what I was here to talk to His Excellency about. And I must say I was hugely grateful for his support of the vision and of this new model of healthcare provision in sub-Saharan Africa. And why cannot the Gambia be the first one to do that? Obviously there are still challenges ahead, but with the support of the government, we are hopeful that those challenges can be dealt with and that this project can be realized soon, I hope.
Professor James Ndao, a Gambian-born professor of neurological surgery and director of the internationally recognized academic urology unit, University of Aberdeen, Scotland, speaking to the State House Press Corps there after an audience with the head of state. The Office of the President has observed that since the last press release on Operation No Compromise on foreign currency hoarding, the general public and licensed foreign exchange dealers have been complying satisfactorily, and as a result, the said office has decided to withdraw the instructions given earlier on speculative activities and hoarding meant to manipulate the Dalasi exchange rate. A press release issued by the Office of the President informs the general public and licensed foreign exchange dealers that the exchange rate of the Dalasi is market determined and would uphold that regime, but would at the same time not tolerate any attempt to thwart the smooth functioning of the foreign exchange market. The dispatch says authorized shipment of foreign currencies through the banking system shall continue under the guidelines established by the Central Bank of the Gambia. Anyone found not playing by the rules of transparent market practices according to the media release will be dealt according to law. It concludes by saying that the authorities would therefore continue to closely monitor the foreign exchange market to ensure orderly operation. The Vice President and Women's Affairs Minister recently joined leaders from across the world for the 17th Interministerial Conference held in the Bangladeshi capital, Dhaka. The convergence, which was held on the theme Evidence for Action, South-South Collaboration for International Conference on Population and Development Beyond 2012, seeks to address issues pertinent to population growth and its implications on the world. And Sotomani has more details.
Bangladesh is the 7th largest populated country in the world, where 150 million people are virtually elbowing each other in a land that is 134 square kilometers in area, with a population density of more than 1,100 people per square kilometer. There are only few city-like states like Singapore that would top this kind of population density. Excluding those states, Bangladesh would make it to the top of the list in population density. What makes the situation even more horrifying for Bangladesh is that the country is poised to lose a good part of its territory to the rise of sea levels associated with global warming, while its very population increases at an unsustainable rate, and this officials say poses a problem for them.
Bangladesh government, the independent government of Bangladesh, when it was, I think, facing severe food crisis and all kinds of difficulties as a result of a devastating liberation war, it adopted a strong policy of population control. And there were very good reasons for it. It's a small country in size, 145,000 square kilometers, where we have, even at that time, something like 75 million people.
The 1994 Program of Action of the International Conference on Population and Development is widely acclaimed as a landmark multi-country agreement which committed governments to achieving by 2015 a range of goals that place individual people and human rights at the center of development. This, according to the Vice President and Women's Affairs Minister, signifies how the world community views the interface between population and development. Madam Jai Sedi continued that the main objective of the Cairo Program of Action is to raise the quality of life and individual well-being and to promote human development by recognizing the complexity of interrelationship between population, reproductive health and development policies and programs.
During that Cairo ICPD 1994 conference, which I was privileged to attend, a consensus was reached. Of course, after a lot of agreements and consultations, on the stance that access to reproductive health and related services, sexual health, as well as family planning, for the young especially, as well as the protection of the rights of women and girls, among others, are all important prerequisites in the attainment of sustainable development for all. The development of women over the years and the young surely we'll all agree trickle down to the rest of society.
Ajah Dr. Isatunjai Sedi said the Gambia, under the leadership of President Jammeh, has taken steps bent on addressing population issues, and the country is already on track to achieving the Millennium Development Goal of universal access.
The Gambia has already achieved the MDG target of universal access and gender parity in lower as well as basic cycles of education. Regarding the rights of women and girls, the Gambia has adopted and ratified a number of national and international instruments that seek to promote gender equity, equality, and the empowerment of women, in line with the 12 Beijing critical areas of concern.
A partner in population development, according to its officials, recognizing building ownership that integrates the recent global development commitments.
On the 20th anniversary of ICPD and the deadline for achieving the Millennium Development Goals approach, governments across the world have renewed their commitment to the ICPD program of action, and there is a renewed focus on population stabilization. The visionaries who forged ICPD have much to be proud of. Impressive achievements have been made since ICPD in 1994, with worldwide reduction in fertility rate, increased contraceptive use, and slowing of population growth rate.
Our commitment in ICPD program of action has been reflected in our policies and programs, and we continuously updating our policies and programs with an aim to ensure universal health coverage for all citizens.
The dialogue is expected to update information for better understanding and strengths and challenges of the International Conference on Population and Development, plus a program of action and the MDGs that will be essential in mapping out a path towards a future development framework. For GRTS News, I am Isatumane.
Staff of the President's Wadna farm have kick-started the second phase of a major harvesting exercise. Wednesday's activity targeted the vast watermelon, plantain and banana plantations, which form part of an experiment conducted on a variety of produce cultivated by the President. Abdunjai has more.
The glee among staff of the president's farm in Wanna has been unrestricted.